Hi, I'm Laura Patrick, and I am here with Dina Stewart, Digestive Health Nurse Navigator. She's been with King's Daughters for 20 years now and is very knowledgeable about digestive health issues that many of us may face. November is a time we think about Thanksgiving and gathering with family and friends, and it's actually GERD Awareness Week, the week of Thanksgiving. So we've brought Dina in today to pick her brain and give us some tips and information about GERD. So Dina, what is GERD and why is it brought up during the week of Thanksgiving?
Well, GERD stands for gastroesophageal reflux disease, and in 1999 it was designated the week of Thanksgiving to have GERD Awareness Week because that is a week where we tend to overeat and overindulge.
Right.
So that's why they picked that week. But GERD is a condition where the contents of the stomach reflux or leak back up into the esophagus where it shouldn't be, and that causes irritation in the esophagus, and that can lead to symptoms such as heartburn, indigestion, chest pain, difficulty swallowing, hoarseness of voice, chronic cough, and regurgitation or spitting up contents of the stomach as well.
Okay, and I know when I asked you what are treatments for GERD, you said, well, it's more important to get diagnosed correctly. Yeah. So what are some things we do here at King's Daughters that can make sure that's a correct diagnosis?
Well, if patients are having these symptoms, they should talk to their physician, and the physician should at that point refer them to a gastroenterologist for correct diagnosis. One of the tests that we do very commonly is an outpatient procedure known as an EGD or an upper endoscopy, and that's where a gastroenterologist will take a scope and look down the esophagus, stomach, and the upper part of the small intestine, looking for areas of damage or inflammation. And they may take biopsies as well to see if there's any changes in the cells. And after that, they diagnose them with GERD. They are usually put on medications such as Nexium, Prilosec, Zantac, Tagamet. Those are medications that decrease the acid production in the stomach. So it's important to get that under control.
So if they're having those symptoms regularly, like you talked about, they should seek medical attention. So do you have to have a referral here at King's Daughters to see our physicians?
No, you do not. You can just schedule an appointment with a gastroenterologist yourself, and that's easy to do. You can call me or call their offices. And then we also have general surgeons that treat patients for GERD as well, so they can see one of the general surgeons that we have as well.
Okay, and I know you've brought a prop today, which is fantastic. Do you want to tell us a little bit about what this poster is saying?
Yes, this poster just we have an algorithm on there about when you should seek treatment. And then we have, one thing I really wanted to point out were these alarm symptoms. I did mention some of those, but anytime somebody starts having difficulty or painful swallowing, spitting up blood, unexplained weight loss, they're anemic, or they have chest pain and recurrent vomiting, those are things that really should directly lead them to a gastroenterologist who's a specialist in digestive diseases. Chest pain, I want to point out that if you're having chest pain, you should always have that checked out first to make sure it's not cardiac.
Okay. So with Thanksgiving quickly approaching, what are some tips we can give our followers and viewers the week of Thanksgiving while they're with their family? You know, don't overeat, right. Try not to go to bed on a full stomach. Do you have any tips?
Yeah, absolutely. Well, don't overeating and laying down. People tend to eat a lot on Thanksgiving Day and then they want to lay down and take a nap. That's the worst thing that you can do. At all times, whether it's Thanksgiving or not, you should wait 2 to 3 hours after you've eaten a meal before you lay down or go to bed. Try not to eat too fast, because the faster you eat, the more you tend to eat. So if you eat slower, then you tend to feel like you're full faster. Not wearing tight clothing, especially around the waistband, because that causes increased pressure on the stomach. So wearing looser clothing is important as well. Another important thing to do would be avoiding trigger foods, things like peppermint, citrus fruits, tomato-based products, caffeine, which unfortunately includes chocolate. So avoiding alcohol and tobacco is huge. Those are really important because those are big aggravators of reflux.
Okay. Well, thank you. Dina is extremely knowledgeable, and we appreciate you being here with us today for this month's topic, which is GERD and GERD awareness. And stay tuned, and we'll have a different topic next month. Thank you.